Thanks for coming to my talk. I'm Diyi, a PhD student at Carnegie Mellon. Today I'm going to talk about my work on commitment of newcomers and old-timers to online health support communities. So this is a joint work with my advisor, Kraut, and Levine. So millions of people use the internet to participate in online communities. For example, they exchange information in technical groups such as Stack Overflow. They meet new people on dating and social networks. They work together for collective actions on platforms such as Wikipedia. They create and consume entertainment on blogs and YouTubes, and exchange social support in online health support groups. Our work deals with the exchange of social support in communities. To survive and prosper, online communities need to recruit new members. New members are crucial resources for online communities. New members share information and form social ties with others, contributing a lot to the community. The group socialization model proposed by Levine and Borland perfectly describes the passage of new members through communities, such as from just joining the group to further accepting or leaving the group. It says that members engage in an evaluation process to determine how well the group fits their needs. In doing so, they consider how rewarding the group has been in the past, how rewarding it currently is, and how rewarding it is likely to be in the future. The outcome of this evaluation process determines members' commitment to the group. For example, in the beginning, members needed to evaluate whether they should join a group. After joining it, they might need to evaluate whether they received expected benefits. Later on, they needed to evaluate whether they should continue participating in the group. Members communicate with each other in all those evaluation processes. In our context of online health support groups, members join those groups when they first get diagnosed. They communicate to discuss their disease, as in this example. This user was seeking informational support and might wonder whether her needs can get fulfilled. Other members come to provide replies to support her, which can better help this user determine whether this group is a fit. All those received communication and support can affect members' commitment to their groups. As members move from new members to core members, such information might not be so valuable to them compared to receiving it in the very beginning. Moreover, later they might have other needs, such as building relationship with others. So it is reasonable to expect that the effectiveness of receiving communication might differ for people in different stages. So this gives us the two research questions. As we said, people join online health support groups when they just get diagnosed and they want immediate help from those groups. They have little knowledge about those groups. To reduce their uncertainty and meet their needs, they have to explicitly seek resources. There are reasons to think that newcomers seek more informational support over emotional support, in part because they often visit those sites when they just get diagnosed, where they still need to obtain disease-relevant information. In addition, early in their membership in support groups, newcomers might have not built up the social capital necessary to effectively seeking emotional support. Thus, we expected that members of lower tenure will exhibit more resource-seeking behaviors by posting more messages, and those threads will focus on eliciting informational support rather than emotional support. To validate this hypothesis, we need to compare the seeking behaviors for people in different stages. To begin with, I'd like to show our research set. Our research was conducted in American Cancer Society's Cancer Survivor Network, which is the largest online support community for people suffering from cancer and their caregivers. Here is a screenshot of the context. We were given permission to get access to all public posts and comments, along with profile information for users who registered between 2002 and 2015. This allows us to use around 1 million messages and 48,000 users for our analysis below. To differentiate newcomer and old-timers, we measure members' tenure in the group and operationalize it as the number of months since that person registered. We operationalize the exchange of social support into seeking and receiving part. For seeking, we measure the number of seeking requests a user initialized and the average amount of support contained in their message. Here, informational support and emotional support are two widely used forms of social support. For receiving, we measure the number of replies users received to their threads and the amount of support contained in their messages. Most research on the exchange of social support has used self-reporting measures from participants or on a relatively small set of messages hand-coded by researchers. Different from them, we build machine learning models to predict the amount of support sought and received in a message with reasonable accuracy. We then applied it to 1 million messages. Based on our machine learning models, each reply will be associated with 2 scores. Specifically, for each thread starting message, it will be associated with 2 scores, indicating how much informational support or emotional support it was seeking. For each reply, it will be associated with 2 scores, indicating the informational support or emotional support contained in it. We then can compare the seeking behaviors of people in different stages. We found that people seek initialize the most threads in the beginning, as shown in those peaks in the very beginning. Of course, this is not a linear trend, and we saw some peaks as well after 18 months, which might reflect users' other needs in addition to informational needs. Here, the y-axis measures the amount of informational support contained in a message. We found that the informational needs decline over time, as we hypothesized. Similarly, people's emotional needs decline as well, but these emotional needs seem to decline slower compared to users' informational needs. To explicitly test this, we conducted a multi-level random effects linear regression model to predict how the ratio of informational support sought per message during a month changes with members' tenure. We found that the informational needs did not decline faster than emotional support, suggesting that for members in online health support groups, those 2 kinds of needs consistently exist. From our analysis 1, we found that members of lower tenure posted more messages, and those threads focused on eliciting both informational and emotional support. For people to get help and advance, they have to communicate. Communication is a major route through which people can reduce uncertainty about the nature of the group and receive the benefits associated with their membership. Members join groups for many purposes, and accomplishing them is crucial for their commitment. For new members, communication can help them reduce their uncertainty and assess their fate. For full members or more experienced members, communication can help them remain active and accomplish other goals, such as building relationships. Thus, we expected that receiving more communication and support from the community will increase members' commitment for both higher tenured and lower tenured members. Here, we use the survival analysis to assess how tenure and the amount and the type of support members receive jointly influence their commitment. We operationalize the commitment as the length of continued participation. Here, the time unit of the survival analysis is a month. Then we measure the number of replies a user received per month and also the amount of social support contained per message. Here, we show the survival curve of receiving communication. So the x-axis indicates the tenure of the month from 1 month to 2 years. The y-axis means the member's probability of staying in the community. This line represents the survival curve for receiving an average amount of replies. Then we added the survival curve of receiving higher number of replies. We found that comments received is associated with lower dropout rate, with a hazard ratio of 0.8. The hazard ratio is the predicted change in the probability of dropout from community for a standard deviation increase in the predictor. This tells us that receiving more comments are associated with 17% higher survival rate. In terms of social support, we found that receiving support, like informational support, is associated with 15% more likely to leave the community. We found similar results for receiving emotional support. That is, receiving informational and emotional support make people leave the community faster. Why? So we provide an explanation that people with short-term need goals might easily get their needs fulfilled and then leave, or they might not be satisfied with the support they received. Basically, from our analysis too, we found that the quantity of communication increased commitment, but the content of communication decreased commitment. However, it is possible that engaging in communication will be differentially effective in increasing the commitment of higher and lower tenured members. The principle of diminishing marginal utility suggests that engaging in communication will have a larger effect on the commitment of lower tenured members. This is because the marginal utility of each new unit of communication decreases if members have previously experienced it. Thus, we expected that lower tenured members should find the communication more rewarding compared to higher tenured members. In contrast, the theory of attraction, selection, attribution suggests that people are more likely to stay in a group when it matches their needs. In such cases, dissatisfied newcomers often leave after joining, and the members who stay in a community will like more what it offers. Those satisfied members will produce a community that is more positive and more homogeneous in terms of member satisfaction. If this dynamic occurs, we should expect that communication have more reinforcement value for higher tenured members than for less experienced members. Similarly, we tested it via the survival analysis. The blue line indicates higher tenured members, and the red line indicates lower tenured members. As we can see, receiving replies increase commitment more for old-timers. In contrast, higher tenured members receiving higher amount of informational support was associated with lower survival rate, suggesting that the support contained in messages benefits more for newcomers. We found similar results for receiving emotional support. Our explanation is, in addition to providing social support, communication also serves other longer-term goals, such as developing relationships or providing help to others. Receiving informational support or emotional support can only fulfill members' immediate needs. To further explain this, we interviewed 12 American Cancer Society users and used their input to provide context and explanation for our findings. As one of them said, I'm not looking for people who are seeking for advice to offer. And I initially found the information was important, but over time, I found talking with people who have the similar experience is more helpful. Overall, the analysis 3 told us receiving replies increase commitment more for old-timers, and receiving informational support, emotional support increase commitment more for newcomers. We found similar findings if we operationalize the commitment as users' self-reported attachment to the group or as users' willingness to help others. To sum up, in this work, we found that receiving communication increased members' commitment, with its impact increasing for old-timers. And we found that the impact of receiving informational support or emotional support decreased with members' tenure. Our findings about the quantity of communication can be applied to general online groups, and our findings about the content of communication can be applied to other support groups, such as parenting groups. The most immediate practical conclusion from this research is that the needs of short-term users and longer-term users differ, and the resources that keep members engaged also change with their tenure. Thus, the health support groups need to present resources in ways that satisfy users' different needs. We urge that online communities to detect user motivations of joining online communities and provide appropriate tools and recommendations for newcomers and old-timers. So thank you for your attention. I'm happy to take questions.
Hi, thanks for your talk. I'm Colleen Smith at the University of Minnesota, and this is really cool for me to see this because I did a similar study in a different online community recently. And I first wanted to just call to attention the fact that I think that different online health communities have different types of ground, they're coming from different places. So for example, the community that I was looking at kind of started in the real world, so people had social networks that they actually bring to their sites, and they have a very different kind of experience. And some of the things that you pointed out, we have different trends that show up in our data. So it was really interesting to me to see that. So I'd love to talk to you afterwards.
Sure.
But my question is related to, when you saw these relationships forming, I'm actually curious if you had any way of measuring or quantifying the social relationships that occurred for these old timers, and specifically how you looked at that.
Yeah, this is a great question. So currently our operationalization to social support that the members exchange only focus on informational support and emotional support. So we see some like social ties built around members. So like they will send each other private messages, like email, and they will quote each other in the discussion forum. So that might be a good way to operationalize the social relationship, like build around them. And that will be another dimension of support. I won't call it a support, but another different dimension of communication. The communication serves the goal of communication. So yes, so maybe like the number of messages they exchange with each other in the private channel, which is a very strong tie, and also they exchanged in the public discussion board.
Okay. Hi, I'm Jake Thiebelt, speaker, also from University of Minnesota. I was looking at your plot of the old timers versus newcomers and the retention of the community based on communication. Yeah, right here.
Here?
Actually, go back one more. Sorry. It looks like the blue curve is always increasing their probability to stay in the community, and you're starting at 0.0, right? And so I was wondering how you think about old timers being a different class of people who are maybe just committed more generally, and stay longer because of that, as compared to the retention in the community due to the communication.
Yeah. So yes. So first, old timers are a different group of users actually. So compared to newcomers, as we found that the newcomers the old timers, they are more satisfied with what the group has to offer them. So they already found everything there was rewarding for them compared to newcomers. And a lot of newcomers coming to support groups from Google search, and their immediate needs is to get information about side effects or diagnose. And after receiving that, they leave. So it's really important that some methods can be developed to detect the motivations. So motivation will be a major difference between old-timers and newcomers here. Yes, thank you.
And I'll ask the last question if no one else wants it. So I wanted to ask if you could reflect on work that Barbosa and Dan Cosley have done. Sam Barbosa, they segmented a community based on like the year, the cohort that they started. And so when you're looking at a long-term community like this that's been around for 13, did you look or do any kinds of analysis of like the behavior of people who joined in 2005 versus 2015? Or if you didn't, would you have any hypotheses about it? Would you expect to see differences in this kind of community based on newcomers starting early in the community versus latecomers coming like a decade later?
Yeah, thank you for this question. Actually, we haven't looked at the difference between people joining the sets in different years. But what we look at is that among their tenure in the group, so they are like in members' first month. So this first month might be in 2015, or it could be in 2002. So this is definitely a future direction we could explore to see that whether our findings are consistent for people joining the sets in different years. Yeah, thank you.
Let's thank our speaker.